Hey everybody, Azim here. We're going to look at different features of bones. We all know that, well, we're going to know every single name of every single bone, but even when you look at a specific bone, you can see if there's a bumpy thing here, there's a smooth part here, there's a long part here, a round part there. All these things have names. So we're going to go over some of the major types of names and the categories that they fit in, because these things matter. Structure relates to function. It's important to know what these things are and what they do. So the first category of a bone feature that we'll go over is an articulation. The word articulation just means whenever two bones meet, that's an articulation. So another word for articulation is joint. I know we typically think of joints as movable, but some joints aren't movable. So ones like between the bodies of the vertebrae, they're not as movable, or these sutures between two bones are not as movable. But let's talk about bone features of ones that are movable, these articulations. So the first term that refers to an articulation is a condyle. One example of a condyle means rounded knob. Here's the base of the skull, the inferior portion of the skull. You see the smooth part here? That's one condyle, and the other one is right here. Those are the occipital condyles, and they're smooth because that allows the head to nod. Oh, this one's kind of stuck, but this allows your head to nod back and forth. Your occipital condyles articulate with the atlas, the first vertebra, the first cervical vertebra. Another example of an articulation is a facet. And we can see this, an example of a facet with this vertebra. Here's a thoracic vertebra. See these flat parts? Here's one flat part. Here's another. And then on the underside, the inferior portion, there are two flat parts. One on the left, one on the right. These are articular facets of the vertebrae, and they allow for vertebrae to stack on top of one another. Yes, they are articulating at the body of the vertebrae here with the intervertebral discs. This joint is not very movable. But where the facets are, from one vertebra to another, this does allow a lot of movement. We'll learn that these are called zygapophyseal joints, Z joints, and they allow the spine to bend and flex. Again, this is not the best example because this skeleton doesn't move very much. But these are the movable joints of the vertebrae because of those facets. Another example of an articulation is a head and neck. So here's the head of the femur, and this is hopefully pretty self-explanatory. It's nice and round, and it has a neck. Heads always sit on necks because the neck is protruding out. This head and neck can fit very nicely into this socket, the acetabulum of the coxal bone. So condyles, facets, heads, and necks, those are examples of articulations on bones. Another very broad category are extensions and projections of bones. And extensions and projections, they're all over the bones because you can see so many points that poke out or are a bit rounded. Extensions and projections are generally points of attachment for muscles, so tendons can attach to those different points, or they can also be articulating points. So there's a whole bunch. Let's go through some examples. This is a coxal bone, and here is a crest. It's called the iliac crest. This ridge is a point of attachment for muscles. On back to the femur, or actually I'll show the humerus. Here's the distal point of the humerus, the upper arm bone. And you can see that there are bumps on either side. This one here and this one here. These are called epicondyles. They are projections that are superior to a condyle. A line is what it sounds like. It's linear. Here's the back of the skull. These lines that come from this protrusion, those lines are attachments. Those are called nuchal lines. A process is just another protrusion any bony prominence. Here is the mastoid process of the temporal bone. Mastoid process just behind the ear, posterior to the ear. A protuberance is a protrusion. Again, just another name for something very similar. So here's the mental protuberance, the pointy part of your chin. A spine is a very pointy, sharp, linear protrusion. Here's the scapula. At the posterior part of your scapula, you've got this large spine poking out, separating the scapula into two parts. This part up here and one part back there. One term that's exclusive to the femur is something called a trochanter. We're looking at the anterior side of the femur, and you've got, it's actually best seen from the posterior side, so let's go posterior. You've got this protrusion that starts here, continues down, and then protrudes down here. This is the greater trochanter, it's higher up. This is the lesser trochanter, it's more inferior, more distal, lower down. Trochanter. A tubercle is a small rounded process. Let's look again at the humerus. Here's the proximal portion of the humerus. You can see the head. Here's that head of the humerus. You can see a protrusion here. That's a tubercle. It's the lesser tubercle. And a rounded protrusion here. That's a greater tubercle. A ramus is a curved portion of a bone. So you can see an example of the mandibular ramus. This is the mandible bone, and this curve is an example of a ramus. Also, of the coxal bone, from the ischium to the pubis, this curvature, that's an example of a ramus. Finally, a tuberosity is another example of an extension or projection. An example of a tuberosity, let's look at, where's our tibia? Here is the tibia. You can see the knee here, tibia to the foot. The tibial tuberosity, it's a rough elevated surface protruding out right here. That's the tibial tuberosity. So a lot of different things that qualify as an extension or projection. All these regions are typically for muscle attachments, so tendons can attach, or they're articulating points. All right, our third category is a depression. A depression is a shallow area which is also for muscles to sit in and attach to. So let's look at some shallow attachments. Here's the mandible, and you can see the teeth are fitting into here. So this is a joint from the tooth to the socket of the mandible. That socket, that's called an alveolus. An alveolus is an example of a depression. So an alveolus in this case is a tooth socket. Alveolus in general just means a socket or a sac, so we'll see alveoli in the lungs. A fossa is a more shallow depression. So here again is our coxal bone, and here is a shallow depression. This is the iliac fossa. A muscle attaches here and sits in this spot. To the femur, you can see another example of a depression. This is the head of the femur, but on top of the head, on the medial side, we see this rounded pit. That's called a fovea. This is an attachment for a ligament from the head of the femur to the acetabulum of the coxal bone. Finally, the fourth kind of depression is a sulcus. A sulcus is a groove that a tendon or a nerve or a blood vessel sits in. So an example of a sulcus, if we look here at this humerus, we're on the anterior side of the humerus, you can see that there's this shallow portion right here. Again, this allows for blood vessels and nerves and tendons to sit inside. Lastly, so we've talked so far about depression, extensions and projections, and articulations. Our last category is a passage. And there are several kinds of passages inside of bones. If there's a hole in a bone, that's a passage. So the first type of passage is a canal. A canal is just a passageway for a nerve, or really just depends. So this is a canal. It's the external auditory canal. Canal can be synonymous with two other terms. So this can also be called the meatus. Meatus is another opening into a canal. So this is the, I guess more accurately, this is the external acoustic meatus leading to the auditory canal. This is the foramen magnum. So here's a third term for a passageway for nerves or blood vessels. Foramen, plural foramina. This is foramen magnum. Another example of a canal would be in between longitudinally through the vertebrae. This is the vertebral canal. So canal, foramen, meatus, they all have very, very similar meanings. There are tons of canals and foramina for nerves and blood vessels to pass through at the base of the skull. So, for example, here is the optic canal for the optic nerve to pass through. Here's the hypoglossal canal for the hypoglossal nerve to pass through. Here's the internal auditory canal. If the hole is longer, so you see this jagged long hole at the back of the orbital, if the hole is longer, it's called a fissure. This is the superior orbital fissure. It houses several nerves and blood vessels. Last kind of hole, passageway, is a sinus, and a sinus is an air-filled space within a bone. So this is the frontal sinus. The other sinuses include within the ethmoid, sphenoid, and maxillae. So there was a lot there. Once again, 4 different categories of bone features. There are articulations, where bones meet each other. There are extensions and projections, which are points of articulation or muscle attachment. There are depressions, which are shallow areas for muscles or attachments. And there are passages, which are holes in bones that allow blood vessels, nerves, or air to pass through.